So, one of the first things the grant does or the center does when they come in is really do this full-fledged assessment, and they call it an FOA. It's a financial operational assessment. And we're a high-performing organization. We think we know our own metrics, and we, thought, what's this really going to tell us? Well, I was really surprised by a lot of the things that it told us because of the way they benchmark us against our peers is different than what we've had access to. And they identified some real gaps in what we probably could be doing as an organization that we're just not doing as well as some of our peers. And we did several things. The first thing was our swing bed program. We put together a multidisciplinary team with kind of the boilerplate that we were given as to how to do that, and really moved that service line forward and have increased it. It was like 58% in terms of our volume in our skilled program. So that climbed big time. The next area, though, was really looking at our acute admissions. And the first area that they identified was our ER. And how come we're not accepting more patients? Why are we not admitting more patients? And so they shared with us this idea of creating I would call it a shared mental model amongst all of our physicians, but they call it a care spectrum, where you define very clearly what services your hospital is capable and have the capacity to care for. And so with the help of the center, we had some consultants guide us through that process. We had an excellent meeting with our medical staff, and our admissions have actually gone up for the first time since COVID. So it really was a game changer. We understand our role in our community as being that cornerstone. And a lot of the work that we did through the community development and the community champion was spearheading that piece of our vision for the future.
My name is Jamie Ficknair. I am the Community Relations and Foundation Director for St. James Parish Hospital. One of the things that resonates the most with me working with the Delta grant was the support that they gave to us. Not only personally as the community champion, but also like the technical assistance that they gave us. They worked with us and provided us a variety of resources that we would not have been available to us. So we're really appreciative to that.
Our community involvement and our patient perception has really increased over the last 3 to 4 years. We did a community needs assessment, which tied into our strengths and our opportunities, and it really shifted the mindset of our organization. Prior to this engagement with the center, we were active participants of care in our community, and we thought we understood our community. Now we're champions of health and wellness. We are bringing players to the table that really had no reason to really participate, but they have a lot of resources, such as industry and the school systems and local government.
In the rural setting, independent pharmacies are struggling. The big chains are putting the small ones out of business, and it's creating real gaps in rural communities. We are not unlike the rest of the country. We had a pharmacy close, and as a result of that, a lot of our 340B revenue was disrupted during that time. So we started our own pharmacy. It's right next door. It's in our medical office building, and it's called Parish Pharmacy. The service line is convenient and all that for our patients because it's right within our medical office building, but it's also capturing all of that 340B revenue.
My name is Maitland Fauché. Everybody calls me Spuddy, and I own the restaurant for a business. For the last 31 years, I'm self-employed. I've seen St. James Hospital grow so much in the last 3 years because we now have a pharmacy. When our local Winn-Dixie was bought out, the new owner said, we no longer a pharmacy. We're out the pharmaceutical business. St. James Parish filled that void because everybody that was left, they were overwhelmed. St. James now stepped up and filled that void. They're gonna build a wellness center in St. James Parish, and it's gonna be good for not only the community, but a whole River Parish region.
Thank you to the Delta Regional Authority and the center for the tools that was provided in this program. Not only did we achieve really great results, but we now have a toolkit that we can use into the future.